Hello students. So today we will be discussing about coronary heart diseases CHD, and also we'll be discussing about all the classifications under CHD. Like we will be discussing about heart attack, we'll be discussing about heart failure, atherosclerosis, hypertension, angina pectoris, congestive heart failure, myocardial infarction, rheumatoid heart disease, and also atrial fibrillation. So, before starting this slide, will be a shortly brief about what is coronary heart disease. So, coronary heart disease is a broad term comprising of spectrum of disease associated with disorders of the circulation, heart muscles, what we know basically the cardiac muscles or the vessels of the heart in particular. We will come across certain common terms associated with heart disease, which are very often used interchangeably. So basically the cardiovascular disease will be discussing about. So this is the slide. What is written is the heart failure. So if we discussing about the heart failure, there basically are three symptoms is been written. So pumping actions of the heart is inadequate. This is number one. Number two, blood backs into the lungs, making breathing difficult, is called the left-sided heart failure. Blood also backs up into the veins, causing swollen legs and feet, is called the right-sided heart failure. So basically the heart failure, if we segregate the heart failure in the two parts, left part and right, so here is written a differentiation between heart failure and heart attack. So what is heart failure and what is heart attack? That we have to clear very much, because heart failure and heart attack is not a similar term. Okay, so in case of heart failure is written heart is not pumping correctly, heart has to work harder. In heart attack, clot in arteries blocking it, lack of blood to heart. So what is actually this? Heart failure and heart attack both are from the heart diseases. So we know it very well. They have some common causes, but they also differ in key ways. Heart attacks happen suddenly when one of the arteries leading to the heart becomes blocked and cut off the blood flow. Without oxygen, the heart muscles start to die. In human being, we need oxygen to survive. Likewise, heart needs oxygen to survive. So if oxygen is insufficient, absence of oxygen, heart muscles start to die. One heart muscle start to die, it leads to heart attack. So lack of blood to the heart, basically the heart attack. One-sided heart failure. What is heart failure? Heart failure, on the other hand, usually develops gradually. The heart muscles becomes weaker and has trouble pumping blood to nourish the cells in our body. This is a chronic condition that gradually gets worse, but medications can help us live longer and better with it. Heart attacks can lead to heart failure. So already I have discussed about the causes. Again, I'm summing you up. So what are the causes? The causes basically in case of the heart failure, number one is the coronary heart artery disease. So what is basically we do talk about coronary artery disease or CHD. So coronary artery disease develops when the coronary arteries become too narrow. The coronary arteries are the blood vessels that supply oxygen and blood to the heart. Basically, CHD tends to develop when cholesterol builds up on the artery walls, creating plaques. These plaques cause two arteries to narrow, reduce blood flow to the heart. A clot can sometimes obstruct the blood flow, causing serious health problems. Coronary arteries form the network of blood vessels on the surface of the heart that feed it oxygen. If these arteries narrow, the heart may not receive enough oxygen rich blood, especially during the physical activity. So, CHD can sometimes lead to heart attack in most common of the heart attack disease that we know. So this is all about the CHD. So already I have discussed about cholesterol. So high cholesterol, triglycerides is all these blah 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 disorders is terms is one condition. This is called dyslipidemia. In your MSc MFN 005 it has been clearly written that what is dyslipidemia is abnormal lipid levels in the blood is called the dyslipidemia. So this is one of the cause. This is one of the cause that. So what are the symptoms of heart failure? This is very important. What are the symptoms of the heart failure? Trouble breathing that is worse during exercise or when lying down. There are some term you must have seen that is called dyspnea, or there are terms is called the nocturnal, dyspnea when you lying down, okay, during exercises. So these are the symptoms. Swelling our ankles, legs, and stomach. Also, we have discussed about ankles, legs, abdomen, and also lungs. So this is nothing but edema. Feeling restless, tired, or weak. Yes, because if heart is not pumping properly, people can feel that. And also gaining weight. So, what is gaining weight? Because now you're not directly, taking the classes through, virtual. Otherwise, if students in front of me, I could have asked them why gaining weight. It's a very quiz kind of thing. Yes, why gaining weight? Because due to edema, due to water, accumulation, fluid accumulation. That's why gaining weight. So if 1.5 to 2.5 kg in a week or 1 kg in a day is a very significant and classical symptoms of heart failure or cardiac failure. So gaining weight that has to be monitored. In case of cardiac patient or in case of heart failure patient, the weight machine is very important that every morning they has to take their body weight. Okay, so these are the symptoms also. Carrying. Having a loss of appetite. There are all the problematic of appetite also. Having a dry cough that doesn't go away. Pinky, spotty, sputum kind of thing doesn't go away. Coughing up with fraudulent spit. Needing two or more pillows at night or having to sleep in the chair. There are a lot of posture is there. You know, foul position, semi-fowler position, fowler position. So these all the way are symptoms. I'm not going too much of details for your MSc part, but this is a very important thing. Someone is goes for research for the heart failure. They has to know how their posture has to be changed for a patient with heart failure. So what are the diagnostics of the heart failure? Physical examination, blood pressure, that you have to check your blood pressure. The blood pressure method, they have to check the blood pressure. Body weight, that already I have discussed how to check your body weight every morning. Every sunny morning, once you wake up from the bed, you have to check your body weight, because for those particularly, there were cut off line is there, like 1.5, 2.5, that you have to understand clearly. So what is actually body weight? Electrocardiogram, ECG I have discussed. Blood test, that sort of blood test like NT-proBNP, troponin T. This is all the blood tests, and also if we consider, we can take the blood test for the EGFR, urea creatinine, blood urea nitrogen. So all the kidney tests as well as also echocardiogram. That is very important things also. So from echocardiogram, we will get to know a term, ejection fraction. From echocardiogram, we will get to know a term, ejection fraction, that I will come in. And also stress test. You know there are two kinds of ECG. One is ECG that is a sitting position, very resting condition, and one is ECG is like too much of after vigorous exercises, called the treadmill test. Okay, or stressed or strenuous ECG. So this is stress test. So these all are the basically the diagnostic heart failure features that we have to know very clearly. here here the part where we are talking about the ejection fraction. So what is ejection fraction? So in case of any, I'm not showing ECG, maybe in next classes I will show an example of ECG. So there a part is written LVEF, is called left ventricular ejection fraction, and there is a percentage is written. Okay, so what is ejection fraction all about? Ejection fraction is basically a measurement of the percentage of the blood leaving our heart each time it contracts. Again, I'm saying ejection fraction is a measurement of the percentage of blood leaving our heart each time it contracts. The heart contracts, heart relaxes. When our heart contracts, it ejects blood from the two pumping chambers is called ventricles. When our heart relaxes, the ventricles refill with blood. No matter how forceful the contraction, the heart can never pump all blood out of a ventricle. The term ejection fraction refers to the percentage of blood that's pumped out of a filled ventricle with each heartbeat. The ejection fraction is usually measured only in the left ventricle LV. The left ventricle is the heart's main pumping chamber. It pumps oxygen-rich blood up into the upward ascending aorta to the rest of the body. And left ventricular ejection fraction of 55% or higher. Okay, also I've discussed about these things also. Monitored cardiac rehab. Lifestyle changes is there dietary modification. That will be another topic, another lecture I will cover. Prescription medication, surgical procedures, implanted devices. This is all there. Surgical procedures that you know very clearly, there are a lot of surgeries as there. There is a open heart surgery, CABG is there, and there are also a stenting system we used to call the angioplasty, that is also are there. A lot of surgical procedures are there also, and there are also implanted devices like pacemaker. There are devices like AICD. There are devices like other heart cardiac devices also implanted in particular case for controlling the heart failure. Lifestyle changes I'm just avoiding because later on I will discuss. Parvati. clearly. Now we'll come to the medications. So medications of pharmacology is very important that we have to know very clearly for treating the patients with heart failure. Not we, but theoretically, we have to know what are the pharmacological or drug importance for managing the heart failure. So diuretics basically water pills. So any kind of help keep of fluid, also known as the water pills, that is the diuretics. ACE inhibitors, the function basically relaxes the blood vessels, makes it easier for heart to pump, like ramipril. ARB is the telmisartan, valsartan. Beta blockers that reduce our work on our heart. Aldosterone antagonists that relaxes blood vessels, make it easier for the heart to pump. Also, there are modern medication that has come up. This is called the ARNI. What is the ARNI? ARNI is basically angiotensin receptor neprilysin inhibitor. Is a new class, relaxes blood vessels and also reduces work on the heart, makes it easier for heart to pump. And also there are calcium channel blockers, or reduces the heart rate. Digoxin helps strengthen of our heart, and also isosorbide or hydrolysin that helps your blood vessels relax, makes it easier for heart to pump. What I have discussed about the angina, this part also, isosorbide or sorbit usually famous in the market. So this is basically an heart to pump is the medications for that. So in cases the function is called there are the three major neurohormonal system that controlling a heart failure patient. Number one is the sympathetic nervous system. There are alpha 1, beta 2 receptors are there. Vasoconstriction will happen. RAS activity, what is RAS? Renin, angiotensin, aldosterone system is higher up. Vasopressin rise up. Heart rate rise up. Contractility rise up. This is renin, angiotensin, aldosterone system. AT1R. Vasoconstriction, blood pressure rise up. Sympathetic tone rise up. Aldosterone rise up. Hypertrophy rise up. And also fibrosis. This part, where we're talking about the RNA, that is the natriuretic peptide system, where vasodilation occurs. Blood pressure low, sympathetic tone low, natriuresis, diuresis little higher, vasopressin low, aldosterone low, fibrosis low, hypertrophy low. So the example, beta blockers are there. Beta blockers is basically the sympathetic nervous system drug, usually drug. We know all the drugs are beta blockers. RAS inhibitors, there are the three important drugs. One is AC inhibitor, angiotensin converting enzyme inhibitors, and there is the ARB, angiotensin 2 receptor blocker, and also amirin, mineralocorticoid receptor antagonist. So this is also the examples of the RAS. And in Neprilysin inhibitors, their infrared fragment, this is also important. So Neprilysin inhibitors are natriuretic and other vascular peptide enhancement. So this is the very classical and modern way for treatment of a heart failure. So, what are the reports when we report? Sorry, what are the symptoms when you report to the doctor? Rapid weight gain, shortness of breath, increased swelling in the lower body, trouble sleeping, frequent dry, hacking cough, loss of appetite. That we have to report to our doctor, cardiologist, or medicine specialist, whatever. So these are basically the patient's history form. Pay attention. causes like dry hacking, worsening shortness of breath with activity, increased swelling legs, feet and ankles, sudden weight gain. So we will always taking care of this part, that will managing of the heart failure patient. So now I will try to conclude this part of the heart failure, that heart failure is a chronic disease condition or a chronic condition. In case of heart failure, we have to take care of the symptoms, that is symptom tracking management. We have to take care our lifestyle modification, dietary part, that I'm coming and showing the dietary part. We have to take care about our clinical features, we have to take care our medications, and we have to take care what a cardiologist, medicine doctor, and also dietitian and heart failure patient counselor says. So in this way we try to control and try to monitor our heart failure. So thank you so much for attending, students. If you have any questions, you talk to your department, and I'm very much ready to reply your FAQs and your queries. So I would love to accept any NAF questions also. But you please try to attend 100% adhering of this slide and this presentation. Thank you.